Well, thank everybody for coming today. I appreciate it, as always. I have to take a medical leave of absence and step away from the team for the remainder of the season due to an aneurysm that they found in my ascending aorta. During a routine heart scan as part of my physical a little over a month ago, the scan, which searches for calcium and the buildup of calcium around the heart, detected this aneurysm in my ascending aorta that requires surgery to repair. I'll have that surgery at UVA Medical Center in Charlottesville in the next week. For the Spiders, Peter Thomas will lead the team in my absence. I'm very confident that Peter will do a great job, as he did here as a player and as a member of our coaching staff for a number of years. I'm sure that he has the support of the Richmond Athletics leadership, as well as the Spider community, and he certainly has 100% of my support and the players' support, most importantly. I do look at this as an opportunity to demonstrate many of the qualities that we try to teach and instill in our players on the basketball court, off the basketball court. And I hope that I can demonstrate to them that while I'm very nervous and a little scared, that I can meet this head on, be a great patient, and show courage with the tremendous support that I have from Leah, Danny, and Ryan, my friends, my extended family, my coaching staff, and my players. I hope that this will be something that I can recover from, or I can recover well from, and I do turn my focus to that right now. While there's never good timing, the fact that we have a bye this weekend will give Coach Thomas and the coaches a chance to spend a few more days than would be normal during the given college basketball season. I was able to tell my players just about an hour ago, which has been by far the hardest part of this. So I appreciate everyone's support, and we'll be happy to answer any questions.
Coach, are you in discomfort? Or you feel all right? This was just something that turned up in a normal, routine physical?
Yeah, it was in a physical, and I have no shortness of breath or chest pain. I've done these CT scans. I don't know if anybody's done them. I've done at least one before and a few since. And like I said, it's just to get a baseline of this calcium, or so I thought, until this detected it. So I have no discomfort or any kind of pain or anything like that.
Heart issues in your family tree?
No. So I don't want to speak too much on the medical side of things, but from what I understand, the leading predictor of this would be your family history and smoking. Obviously none of those for me, and so I think just bad luck.
In 18 years, have you missed a game?
Never. I don't think I've ever missed a practice. If I've been out recruiting, we've usually made those workouts, so no, I've never.
How was Peter chosen to be the interim coach?
Well, I think he's has the most years of service at Richmond. I think that he, having been a player here with us, and how he earned a scholarship here. He's been a tremendous coach, and I have full trust in him, as I do the entire staff. I think Peter will do a great job.
Is it your intention to totally separate yourself from the program for a while, or consult and help out when they have questions regarding recruiting and game management?
Well, I don't think I'll be in the hospital for, from what they said, 4 to 7 days following. So I would imagine during that time, I won't do much consulting. And I think we've talked as a staff. I think we have to kind of see how that goes. Obviously, there's I want the guys to hear Peter's voice and, get on with as seamlessly as they can without me. So therefore, I don't want to be calling at halftime or anything like that. So I think I would err more on the side of being away because I think that's what's best for the team.
Do you get a longer range sense about your ability to return to this job that includes obviously a lot of stress and a lot of weird hours and a lot of work?
Yeah. We met with, if you remember Grant Golden's issue years ago, I'm lucky my best friend in Richmond is Leo Gazzoni, who is a heart surgeon. And he recognized Grant's issue as a heart issue at the time when we really all thought it was a head injury. And so both in talking to him over the last 10 years and specifically, this last month, no, I don't think that's going to be an issue. I don't think there'll be any limits on, once recovered, I don't feel like there'll be any limits on what I'm able to do.
This may not be a question for you, but I'll ask it anyhow. Do you have any idea when that will be? Are we talking April or May or June?
So the best I can give you is what I've been told so far, in that you spend many patients spend about a week in the hospital, and the recovery is between a month and 2 months. Depending on, obviously, every person's different and any complications that might occur. So hopefully I'll be a great patient and I'll have some good luck and it'll be sooner, but I can't really speculate as to when exactly.
Thank you, Coach Mooney.
You mentioned being scared, which I think was somewhat evident in the way you told us what's going on. How'd the players handle that?
I mean, shock. We spend an incredible amount of time together, especially during the season, the whole year round, but especially during the season. And so, I've been, these tests and meetings that I've had, I've tried to go either, first thing in the morning, after hours, days off, those kinds of things, so as not to cause any disruption with the team. And so I think they're pretty shocked. It's an emotional thing. It's a unique situation. We're going to have dinner tonight together so that, beyond this announcement or this news, that we can talk and, be in close quarters. They can ask me questions. It can, I don't know if it's soften the blow, but it can be a little bit more of time together when they're not as surprised.
And you said that this was diagnosed a month ago. What's this month been like knowing you have this condition?
Yeah, so like with anything, it's not black and white. And so the first scan showed something that could be a little bit alarming, and the subsequent scans have shown. So it's not exactly 1 month from the first scan. It has been, it's been a lot of discussions with Leah. It's been a lot of discussions with Leo Gazzoni, the heart surgeon, and just trying to get as much information as we can, as well as get a better prognosis, which can happen overnight as much as you would like it to. So I think I remember making a promise to Leah that I'd be calm on the sidelines. I'm not sure if I kept that promise so much, but it's certainly something that lingers. The focus that goes into a basketball season in one way has probably helped me not, focus so much on the coming surgery. But it has been, it's certainly been a balancing act.
And this procedure, not to get too specific, but is this like putting a stent in, which we hear about all the time, or is it something different?
Yeah, I don't think it's exactly that. I think what happens is an aneurysm at this size, they'll go in and remove that, and then they replace it with something, but I don't know the medical term for it. So I guess, the danger is that, one, it could grow to the point where it stretches the wall of the aorta and there could be, blood leaking, or two, it could rupture the wall of the aorta, which could be catastrophic. And so, from what I know, the surgery, while heart surgery is straightforward, as I was at UVA yesterday for this pre-op meeting, and they thought between 3 and 4 hours of a procedure.
Have you ever had any kind of major surgery?
I have not. No, I've been had a good run, and so I have not actually.
Does having gone through that with Grant and how scary it was when that happened, and then to see you be assured that it was okay for him to come back and play, does that give you any kind of peace of mind?
Yeah, I think again, my relationship with Leo and having seen Grant, Grant's was different, of course, but it was so incredibly scary when it happened, and then, for lack of a better term, fixed, and then he was back, and so yeah, I think that certainly gives you peace of mind, and I'm only looking for the good stories now to keep that peace of mind. But yes, for sure.
Have you talked to coaching friends or coaches who've had to do the same thing, maybe not the same procedure, but had to go through a process that they had to step away for personal reasons?
You know what? I have not yet. I haven't spoken to many people, but I have not. And the only coaches that I've spoken to are people who have worked, on our staff, who are friends. But I have not spoken to anyone yet.
How do you expect to be able to handle, like will you watch games while you're in the hospital? Or is that too much to ask?
Yeah, that I don't know if that would be wise. We'll cross that bridge when we come to it, but I probably won't.
And how do you grade yourself on keeping your promise to Leah to be calm for the last month?
B minus.
You touched on your long-term future, but when you first heard the prognosis, was the first thought like, this could end my coaching career?
Not necessarily. More because my relationship with, so when I had gone for a second scan and the doctor called me and he didn't tell me the results, he said he'd meet me at my house. I figured that wasn't the best of news. But really, in becoming such good friends with Leo, I've heard many of these stories, and long before this has happened, the confidence level that he has in being able to repair as a surgeon, and being able to make repairs and do these kinds of things is so strong and so high. And he walked me through it essentially immediately, that I didn't have that. I didn't have time, I don't think, to develop that fear.
Is he doing the surgery?
He's not. He is not. Yeah.
Good call there.
Yeah.
Don't want your best friend to
Right.
do that.
Exactly.